Now our next speaker is Will Ritowski. Will is a student at Alden High School, and he's a member of Reality Check, which empowers youth to become activists in the movement to change community and social norms regarding tobacco use. Will is here today to discuss why ads like Separation and Artery are important to him. Will?
Thank you, Dr. Willett. I am flattered to be here today, and I'd like to share why ads like Separation and Artery are important from a youth perspective. I am 14 years old, and I'm about to become a sophomore at Alden High School. I don't smoke because I'm a competitive swimmer. I do know firsthand how deadly cigarette use can be, though. Both of my dad's parents, my grandparents, were longtime smokers, and they both died of lung cancer before I ever got the chance to meet them. That feels unfair to me. Nobody should ever have to grow up without their grandparents because of cigarettes, and I know my grandparents didn't try to hurt their lungs. At first, maybe they didn't know how bad cigarettes were, and then, when they didn't know, they were addicted. They didn't know how to quit. That's why I think these ads are important, because they make people pay attention. They scare people, and they make them think about quitting. Separation and Artery are really strong ads. Lots of them make people aggravated. They might ask, why would you put these ads on TV? But I think they're important ads. People will notice them, and smokers might realize that quitting is important. Maybe they'll call the quit line for help, and maybe other kids won't have to grow up without their grandparents. Thank you.
Thanks, Will. Next up, Dr. Maansi Bansal-Travers is a research scientist at the Roswell Park Cancer Institute's Health Communications Testing Lab in the Department of Health Behavior. The lab focuses on testing materials, including cigarette pack design variations, print messages, television ads, and so on, using web surveys, focus groups, and eye tracking methodology to help produce the most salient and effective health communication campaigns. Dr. Bansal-Travers has also recently been appointed to the Tobacco Control Programs Advisory Board, and we're very happy that she's going to be helping us further reduce smoking in New York State. Dr. Bansal-Travers?
Good morning, and thank you, Dr. Willett, for your introduction. Artery and Separation are strong ads that are meant to and will evoke an emotional response from viewers. Ads that evoke this type of emotional response not only grab your attention, but also tend to be more effective at conveying a message. In this case, the message is obviously that cigarettes are deadly and that help is available in the form of the quit line. Ads such as Artery and Separation, ads that are hard-hitting in nature, are memorable to people long after they view the ads. This type of internalization of the message makes the ads effective and makes it more likely that viewers will take some sort of action regarding their smoking. It's important to understand that the ads we're showing you today were not simply produced and put on the air. I did not test these specific ads, but I do test similar ads, and I can tell you that there is an evidence-based reason and a testing process that occurs in making the decision to air them. These ads were pre-tested. They were shown to members of the target audience, in this case to smokers. During this testing, smokers see ads and then respond to several statements and questions that measure their likely effectiveness, including, this ad gave me good reasons not to smoke, this ad made me want to stop smoking, this ad grabbed my attention, this ad is powerful, and this ad is convincing. Ads are oftentimes edited and changed based on this type of feedback. This type of pretesting is critical in making sure that the ad is both impactful and appropriate. We work very carefully to assure that the ads we air will be effective and that they will motivate smokers to quit smoking. In terms of motivating behavior change, Artery and Separation are effective because they increase a smoker's awareness of the cumulative damage every cigarette smoked does to one's health and to the lives of the people they love. These hard-hitting why to quit messages create a motivational tension within the smoker, resulting in a smoker's emotional decision to make an immediate quit attempt. Smoking is the largest cause of preventable death, and it is a major risk factor for cardiovascular disease. The good news is that when a smoker sees these ads, which are designed to create a strong personal and emotional response, they are more motivated to quit because of that connection with the deadly consequences of smoking. This is true for ads that reflect risks to their own health, as well as how these risks affect their families. By airing these ads, we are seeking to increase the number of smokers likely to seriously consider quitting or make a quit attempt, while at the same time help to encourage ex-smokers to stay quit.
Thank you, Dr. Bansal-Travers.